Still, our bowlers, they were able to swing the ball. So it was just the first ball, which was like short and it was hit for four. Second was it was by chance. It can happen when it went back. But after that, what started was like a mind game. And if you really watch, not in the highlights, but in the real match, right? If you just watch that area, it was like the body language, right? Gradually, the body language of the opposition, it was going weaker and weaker. Matlab, they were so unsure. They were so unsure. Huh, that's right. That's right. Matlab, he came with the broken hand because there was no other alternative. But it was an amazing win. In fact, we got the confidence from Manchester when we saved that match. And then the morale was pretty high. But yesterday, though, they were killer. They came with that killer attitude.
Good morning, sir.
Good morning. Now, so email and we'll discuss. Those, yes, there are. I have written all the points, because so many emails they were answered. Like we'll discuss it in class, as it was a common thing asked by number of people, right? So that's why I have put it like that. So let's start with those replies. And this is lithopodian X-ray, which you requested that it was not put into a last note, last PDF or it was PPT. Like, acha. Questions were asked about immunity, PCOS, weight loss, eye care, fat loss, urine color, X-rated contents, addiction, relationships, low energy, and the personal training. Right? Very quickly, I'll go through all of them. Right? I have already written certain things to make things easier and to save time. Regarding the immunity, three things you need to take care of about. One, say regarding the gut health. We have already talked about the gut health. Right? It is so important. These are the bacteria which are present into small intestine and large intestine. And they are the makers of serotonin, one of the happy hormone. And this serotonin, which stimulates the vagus nerve, which is a 10th cranial nerve, and that is how the brain is affected. So if the pet theek nahi hai, so they cannot work, right? So for your immunity, gut health is vital. Gut health can be improved by very simple things. One, avoid sugar. Avoid sugar. ये अपनी white sugar. The white sugar addiction is so high, it is considered as that it is 40 times more addicted than cocaine, right? It is that difficult. So that's why you need to be very focused. Processed food, because they contain that monosodium glutamate. Monosodium glutamate, which straight away affects the brain, and you are tempted to eat more and more and more. Right? So again, not a very good thing. The next is this probiotic and prebiotic. In that, yogurt, kefir, and the fermented foods, right? They are the best. And in prebiotic, you can have garlic, onions, and bananas. These are the list is long, but I have put something so common that it is easily available. So this is for the gut, because if the gut is good, immunity will be very fine. Right. Second, your immunity will go to dust if you don't get proper sleep. This is vital, right? So here quality matters. And for that quality, all those things which we have discussed in past, right? Like you will not be watching, yeah, that is, you'll be away from the screen at least 30 minutes before you go to sleep. It's very important, because your retina will feel like that this is such a bright screen. Din ho gaya, right? It's a daytime. Now the mobile screens and the laptop screens, that the brightness or the illumination factor is so high that brain perceives is in a false way that this is a daytime, and then you will find it difficult to sleep. On top of it, the second thing is the temptation. To kuch आवाज हुई, अरे क्या हुआ, right? Is the Donald Trump asking that should I decrease the tariffs on India? Right? We feel like that, right? So the thing is, stop that temptation. You can keep, that is good, then you keep it. Or even say in iPhones or even in Android, right? There is a timer. So exactly after that, the screen brightness and everything
Yes, sir.
goes to the night mode, right? So that can also be done. So quality matters. Second, exercise just before you go to sleep. Now, this exercise, it should not be weightlifting, it should not be hard exercise, it should be such exercise that you sweat a bit, but at the same time, you're not exhausted, right? So, what could it really be? Start a song which you like, 5-10 minutes, right? Not more than that. Put headphones, or if not, TV ke samne, start running, start jumping, whatever you like, right? But the body should move, right? It could be anything, right? But this will make a big difference. And second, magnesium. Magnesium is one of the important concept, and there are various salts out of which magnesium glycinate, right? Magnesium glycinate is considered as very good to induce the sleep. It is not a sleeping pill. Remember, it is not a sleeping pill. You can take in case if someone is having read 2-3 emails for that, that you're finding it very difficult to sleep. In that case, you can take melatonin, right? You can take melatonin. Melatonin is a neurotransmitter which is released by our brain to induce the sleep. Now, melatonin you just take in the dose of about 5 milligram, very low dose. Don't increase it. Don't take 2, 3, 4 tablets. No, just take one tablet. This is not diazepam. Diazepam is something which tells the brain, "Chal bet, go to sleep." No, melatonin will be inducing the sleep naturally. But because it is, you are as such indirectly playing with the neurotransmitters of the brain, right? This is artificial neurotransmitter. Naturally, also melatonin is released. So, yes, this is good. This is okay. Only if you really feel like मुझे 2-2 घंटे तक नींद नहीं आती तो, right? And trust me, certain things they do release your neurotransmitters very effectively, right? And then there is no harm in watching, say, if you like any specific movies, so just watch that song. There is no harm in it, right? I mean, whatever your eyes feel good, not the X-rated porn, right? Mind well, right? This is, it has to be like what I said, 50 Shades of Grey, right? One of my favorite movie. But yes, it is something which induces very good sleep. Right? So magnesium glycinate, that can be taken. It is very safe. It can be taken every day. Melatonin only on the day, say for example, tomorrow morning you have got the exam and you need to have a very good sleep. Then that point melatonin will help. These are certain biohacks, very important. Important nutrients for the immunity: vitamin D, zinc, and vitamin C. Vitamin D, sunlight, nothing like that. But nowadays, because of the pollution, the amount of sunlight which you get is less. So that's why try karo adha ghanta, right? Say around maybe 7 o'clock, 8 o'clock, depending upon the city again, right? But have some sunlight. Otherwise, supplements, so they are already always there. And for all those who have sent your reports, and I have written that things are very low, right? It was in the range of about vitamin D3 was in the range of about 8 to 10, 12, right? Someone was having 6, someone was having 12, 14, all those. If you are below 20, if the D3 level is below 20, then 60,000 IU, 60,000 60K international units of cholecalciferol, which we have already discussed. You can take it twice a week, right? And that can be taken for at least 2-3 months. After that, you can just test it again, but this will be fine. This is a this is a fat soluble vitamin. D3 is a fat soluble vitamin, so that's why it will take time before you'll start watching its level getting elevated. And B12 is water. Yeah, that's right. It is a water soluble. Wait, let me keep the chat open on one another screen. Yes, we talked about it. Jesh, that's okay. Utla, good morning. Hey, Smith, we could change everything. That's right. So keeping practice of what. All right. So coming back to this, right? Regarding the and so zinc and with vitamin C, citrus food, right? Fruits, etc. 1000 mg is ideally needed for the body. which is equivalent to about eating one amla or two lemons or two oranges. It's not much, and even the supplements are available very cheap, so one can opt for it. It is in the form of powder. Just put it into your drink. Many of your pre-workout drinks will be having vitamin C in that. Just check it out. On to this PCOS. For PCOS, I mean, to all the friends, right, who are having this problem, to everyone almost I have written like will answer in class. This is polycystic, right? It is the polycystic ovarian syndrome, usually diagnosed by ultrasound. Right? You send me your ultrasound reports also, and in which the when the ovaries they are hypertrophied, or in which you see cyst is like a collection, right? In which there is some fluid, and these are the round, medium to small size. It varies from person to person, but it increases. It is present. It can be present even in the other areas. This is a very typical hormone dependent thing, right? But it is like for PCOS, polycystic ovarian disease, no need to straight away go for hormone replacements, right? Don't go for it because once you start that, right, you'll be very much dependent on it. And this is the age when the hormones they are getting balanced. When the hormones are getting balanced, give some chance to your body. So what my approach would be in such cases, or my advice would be like that do something so that your body goes into that natural state, in the balanced state, easily, instead of going for medicines, right? Yes, I read your all emails when you are prescribed some crazy medicines, and and something which really imbalances your insulin system. So this is what you start with. Now in case if you are on any of the medicine, right, as you wrote, you continue taking that, but then you can taper it off gradually as you are comfortable with the system. See, this is very easy. First of all, you need to take care of your food. There are certain foods. Right now, we are not going into the detail of that. What exactly will it do to that cyst, right? But one thing is you cut the sugar. When I say cut the sugar, that means 100% total zero. White sugar, apna zero, absolutely zero. If you can't stop yourself, then take that gudka powder, right? That is easily available. It will also give reasonable sweetness, but this is what you need to control. This is first thing. Then just figure out that there are certain foods, because if we'll keep on discussing this, this is like end. It'll take 2 3 hours. We can talk so much on that. But glycemic index, glycemic index, you know that when we eat something, how fast it releases the sugar into our bloodstream. So if we eat tarboos, watermelon, is high glycemic index. So even if we say watermelon has got so much of water, yes, that's true. 95% is water, 98% is water, but the amount of substance which is in it, it rushes into the bloodstream at such a fast rate that it glucose spikes. All right, just a minute. Just a minute. I'll be back in less than a minute. So low glycemic index, right? So when the that it is released slowly. So veggies, nuts, dal, etc. They are the low glycemic index. So you can just Google and you'll find a big list of low glycemic index foods. IF, intermittent fasting, that is very vital. Even this is good even for the boys, right? It is good for everyone. When you don't eat for 12 to 14 hours, We talked about that importance of fasting for 72 hours. Okay, so many emails. Just yes. So intermittent fasting, that is, you fast for say at least 14 hours a day, you automatically start feeling so light and so comfortable. If you can extend it to 16 hours, it's still better, right? It's still better. All whatsoever I'm telling you is something which I'm following. I do 16 hours of absolute fast. I just take water and say there won't be any loss of energy, right? As you asked, no, there won't be any loss of any sort of energy, not at all. For the supplements, you can take berberine, right? To all the friends, those who are having bit serious problem of PCOS, berberine, right? This is berberine. That is a supplement. It's a tablet, right? It is slightly expensive, right? You need to spend about $1,000, 1,000 rupees a month, but it is pretty effective, especially for the PCOS. Next, for your hormone regulation, right? Some strength training. What strength training is? When you either lift weight or you can have those stretch bands. There are stretch bands available. They are available in the form of various strength: low, medium, high, heavy, super heavy. Right. So what really happens? That is when you are lifting the weight, your body is knowing, right, that on both the sides, let's say there are 40 kilograms. So total you are lifting 80 kilograms. So then you are pushing it. But what happens is that when you start, right, it is at that point when you find it difficult, when the chances of muscles getting stretched is very high. But once your momentum improves, so then rest is all easy. So this is the reason why it is said that if you use the stretch bands, so because stretch bands, they will be implementing the resistance gradually as they get stretched. So that's why it is considered as much better as compared to the weightlifting. Second, to do weightlifting. Yes, at my home, I got the entire weightlifting set, but still I use the stretch bands at night just before I go to sleep. Right? So strength training, you can take if your strength is more, so you take the medium strength. So that will be like a very comfortable strength training, good for sleep. For hormone regulation, that's what I'm telling. You don't have to go for very heavy stretch band. You just do some strength training, some stretch bands. If it is you want to lift weights, then also it is pretty good. Most important, stress management. Stress, because even in your emails it was so evident that there is high amount of stress which you are taking. Like, don't do that. This is with reference to even this part in your relationship. And I'm really sorry, but to some of you I've written very harshly, right? So the thing is, it was in, मतलब आपका अच्छा सोच के मैंने वो सब लिखा है, but without taking name, that's what I'm telling you. Don't destroy yourself. ठीक है, इतने में बहुत आ गया. Don't destroy yourself. मतलब कोई कोई आपको रील्स भेज रहा है and then you are getting carried away कि यार doctors are healers, so मुझे बुरा लग रहा है. Let me write one thing. This is what is called as the gaslighting, right? Gaslighting. It is not only for females, it is for every male also. Gaslighting मतलब क्या? बड़ी blunt language use कर रहा हूँ, but सामने वाले को ना पता है क्या करना? Break the confidence. This is one of the very dirtiest thing, very dirty thing. मतलब जब दिमाग खराब हो ना आप लोगों का, when you feel like कि बस आज कुछ बेकार ही पढ़ना है, I'll send you a book. Literally, there, that male, he gaslights that female to such a level that that female goes into the well of guilt. Itni bhayankar guilt, though the fault was of male. Now, this is what is called as the dark psychology tricks, right? Never to be used. It is such a thing, and in many of the cases, if the female is intelligent and male is not ज़्यादा नहीं कमाते, तो you must have heard. मतलब ऐसे ताने मारना, ऐसी ऐसी चीजें बोलना, and that leads to the crush of entire intelligence. It is crushed, it is destroyed, and then it becomes very difficult for a female to come out. So gaslighting is breaking someone's confidence and generating so much of guilt by inducing the emotional sequences in such a way, by sending all these गाने फाने पुराने नए, मतलब चुन चुन के sending those reels. It is all बकवास. दिमाग से सोच, ठीक है? Think from your brain. मतलब you are not that फालतू. And then if you say कि doctors are healers, तो पहले खुद को treat कर, right? First treat yourself and then think about कि मैं दुनिया को सुधारूंगी, right? I'm telling you, ने नाम नहीं ले रहा, but पता है किसको बोल रहा हूँ. So I wrote very harsh email, but it was necessary, right? And block करना और delete करना. I mean, I was irritated. Still I am irritated. I mean, मतलब sorry. बट अगर जो कोई ऐसा उल्टा सीधा कंटेंट भेज रहा है तो डिलीट करना नहीं आता. व्हाई आर यू वाचिंग दैट कंटेंट एंड देन गेटिंग इमोशनल कि मुझे ये हो रहा है वो हो रहा है. व्हाट नॉनसेंस, राइट? बिकॉज इफ आई गेट सच ईमेल्स ना, मैं रिप्लाई करना बंद कर दूंगा. इफ आई एम टेलिंग यू समथिंग तो यार ब्लॉक करना सीख. डिलीट इट. बिकॉज पता है कि दिस इज लाइक अ पॉइजन. वो पॉइजन दिमाग में जाता है तो उसकी मांगे, मतलब इट अफेक्ट्स. बस you are जिंदा आदमी, right? You are a live person. It affects your career, it affects your studies. तो बिल्कुल नहीं. Don't let anyone, मतलब आज नहीं, पूरी लाइफ में ये याद रखना. Don't let anyone gaslight you. And even males maybe. It happens. It happens. कौन सा मूवी था यार? मस्त मूवी था. Hmm,
एक्टर सर, एक्टर.
वो गाना था ना, बन गया कुत्ता. देखो कौन सा मूवी? हाँ यार, प्यार का पंचनामा. आई थिंक प्यार का पंचनामा,
Yes, sir, maybe.
है ना? हाँ वही था. दैट वाज द मूवी. मतलब
सर यस
all
सर,
girls
प्यार का
don't feel that,
पंचनामा.
but it is necessary for every male to watch that movie. साला क्या मस्त उल्लू बनाते हैं, राइट? दे, आई मीन, मैं इतना ही बोलता हूँ, मेल फीमेल, देयर शुड बी द बैलेंस. देयर शुड बी दैट स्वीटनेस कि बात करो तो हाँ घंटों तक बात कर सकते हैं विदाउट एनी टॉपिक. बस दैट्स द थिंग. ये क्या मतलब, इट इज नॉट लाइक अ कोल्ड वॉर. So let me keep this thing over here so that you always remember gaslighting. It is, in other words, it is emotional blackmailing. So coming back to this, stress management. So stress इससे जो होता है, that will destroy your PCOS. इतना खराब कर देगा, right? Ashwagandha, that is a natural thing. It is called as the adaptogens, right? So ashwagandha is considered as very good. You can just have one tablet. It will keep your hormones at a good level. Plus, it will also be affecting the thyroid, right? So if someone is having hypothyroidism, in which case the TSH, thyroid stimulating hormone, is more, that means brain is telling thyroid काम कर, बार बार इसको TSH भेज रहा है, and still there is low T1 or right. So when T3 T4 are less, TSH is high, that is hypothyroidism. So in such cases ashwagandha helps. If you are feeling low at the end of the day, low energy, even daytime में भी नींद आती है, actively काम नहीं होता, focus नहीं रहता, so just test your, get your thyroid profile. No doubt. There are other reasons also, but thyroid profile is something which takes the metabolism level to a very low level. And then if there is no energy, if there is less of the ATP synthesis, so obviously it will be leading to low energy, focus सब में फर्क पड़ता है. अच्छा,
सर व्हाट अबाउट आफ्टरनून क्रैश?
afternoon crash. Try for the afternoon crash, try to do one thing. Take a power nap. Right? of not more than 20 minutes. Try to do this biohack. Take black coffee if you are taking black coffee, no sugar, no milk. And this should be step one, take black coffee and then take a power nap. If you combine these two things, right, I put a video on my channel on this. But if you just do this after 22 minutes when you wake up, you will find that you are at a very different level.
The adenosine receptors are released, right? Something
Mhm.
like that happens after sleep and coffee.
Yes. So it is like say acetylcholine, right? We don't want our acetylcholine to be destroyed. Bus. So those diesterases, we are just stopping them that don't destroy it. So the same amount of neurotransmitter which is between those two nerve endings, it'll keep on working, right? So but that's the thing.
Okay.
So this can be tried. Ideally, one very important thing I would like to say, though this is again, this thing will be costing you per day about 3-4 रुपए ज्यादा लगेंगे. But after 2 p.m. दोपहर को 2 बजे के बाद, in case if you are very tempted to drink coffee, so then you should go for decaf and not the regular coffee, because regular coffee stays into your bloodstream for about 6 to 8 hours. Half life is 6 to 8 hours. That means यहाँ से 8 घंटे ऐड करो तो रात के 10 बजे. That is that 10 बजे also रात के, it is almost 50% of the coffee is still working, right? So it won't let you sleep properly. So that's the reason. Now against that, say for example, I am a very fast coffee synthesizer. You give me coffee even at 8 o'clock in the night, and you tell me that let's go to sleep at 10 o'clock. No problem. So I can go to sleep at 10 o'clock. But it is not. It varies, and it is like a God-given thing. So it's not my contribution. I have not done anything. But there is 5 to 7% of people, those who synthesize the coffee at a very high pace. Now, why to go for that complications? Right? Simply avoid. I even if that, वो तो जब कहीं बाहर गए हैं, say for example when we were in मानसरोवर, right? तो वहां पे ठंडी इतनी थी, तो I used to have coffee at even 10 o'clock in the night. But it was a pleasure watching the sky. Entire Milky Way galaxy is something what you can see over there, right? Because of no pollution. But well, say after 2 p.m. in general, go for decaffeinated coffees. These are the decaffeinated drinks. So in which there is no, your sleep won't be disturbed. So this you can try. Coming back to this, we already talked about sleep. We already talked about gut health, right? Same principles, what we already discussed. So this is what is called as the polycystic ovarian syndrome. Regarding the weight loss, now it varies from person to person. And I'll come back to this. Regarding the eye care, right? Yes, eye care, it is crucial. Right? And I'm sorry you asked it 3-4 times, but I replied to some of the emails, but 2-3 emails they were left out. I saw them later. Start with this. I have given this entire sequence to many of you, but for those to whom I missed, follow this 20-20-20 rule. This is a rule which can be followed by everyone, because you need to take care of your eyes in any case. The rule is every 20 minutes, right? You are studying, put an alarm or put a timer of 20 minutes, and then watch something which is at the distance of 20 feet. That means the far vision. Keep watching it for 20 seconds, right? So that the muscles, they are working for the far vision. Then once again, you go back to your studies, right? So when you do this, the muscles won't be fatigued, those closed muscles, right? Right now we are not going into the anatomy of all those rectus and obliques and how they are working and what is the light reflex and what is the adaptive method afterwards, right? But this is a simple rule, 20-20-20. Every 20 minutes watch for something, some object. It could be any object. खिड़की से बाहर देख लिया. It is not so कि मतलब गन लेके मापा के exactly what is the which object is at 20 feet distance. The far vision, right? सामने building ho, someone is good who is over there, so you can watch, no problems, right? And you can have a very good excuse that I'm just following 20-20-20 rule.
Hello, sir.
हाँ बोलो.
Can we do this with specs or
Absolutely.
without?
नहीं
Okay.
with specs, with
Okay.
specs. सामने वाला दिखना भी तो चाहिए ना अच्छा से.
Yes, sir.
Okay, then blink often. Okay, blink often. Avoid rubbing. This is crucial. मतलब कई बार वो अपने आंखें सवेरे उठते ही शुरू मत करो. Blink. We don't want very sensitive our eye structures, right? Conjunctiva is very sensitive. So कई बार जब we just rub our eyes, जब आंख मलते हैं तो knowingly or unknowingly we are damaging the blood circulation. So don't do that. Just blink. That is fantastic thing because it is a natural tears. Right? Natural tears. In case if you feel like that your eyes are getting very much dried, so then you go for artificial tears. Artificial tears means इसका नाम ही artificial tear है. And it is OTC, over the counter medicine. You don't need any prescription. You can get it easily. Anti-glare screen needed. As such, you can, there are up to settings aati hain, so you can just turn on the blue screens, right? So that way it will be, glare would be decreased. For the food, zeaxanthin, right? That is very important. So spinach, which I eat a lot. I don't take eggs, absolutely veg, don't take eggs, but I'm not against it, right? So eggs, those who are eating, so that is also good. Vital, hydration. The rule is, you have asked this thing so many times that my weight is 63, how much water should I drink? But a simple rule, ध्यान रखिए. 1 liter of water for every 20 kilogram of your body weight. If your weight is 80 kilogram, so then you have to drink 4 liters. If your weight is 110 kilograms, so yes, you will require 5.5 liters of water, even if you are interested in losing weight. Right? Even if you're interested in weight loss, but yes, water should go because water is something which won't react to anything. It is inert, but it takes part into so many metabolic things and the flush out of your toxins. So ये rule याद रखिएगा. So that settles that how much water to be consumed. Coming back to this, right? So we talked about immunity, we talked about PCOS, we talked about eye care, and regarding the urine color, urine should be absolutely transparent. So if it is yellow color urine, that means समझ लीजिए आप कम पानी पी रहे हैं. Simple, right? When you start drinking water, as you said that, right? I got one that बार बार वॉशरूम जाना पड़ता है इसलिए फिर मैंने पानी पीना कम कर दिया है. नहीं दोस्त, वो मत कम कर. Right? Don't do that. Your kidneys they are getting adjusted. Right? They are getting adjusted because it is like suddenly इतना load आ गया. Right? You were drinking मतलब less than, वही लिखा था ना, मतलब तुम 1 लीटर से कम पानी पीते थे and now you have raised to 3 liters. So it happens. It is like a 3 times extra load on the kidneys. So kidneys would react to that. Continue it for 3 days, automatically things would be adjusted. But urine color, that should be transparent. It should be like water or slightly yellowish, not the dark yellow. And one more, never the red color. Never the red color. Now, when it comes to red color, two things are possible. One, if you are sometimes if you are near your periods, then that spotting may impart slightly reddish color, but it is just a reddish color, never a frank red. Correct? So just understand that part. But otherwise, routinely, for males, if you are going for very heavy workout, so yes, it would happen like that urine will be of dark color. Reason? Person is sweating so much, so body has lost so much of water. Now kidneys would say that we can't afford to lose so much now more water, so that's why that urine would be concentrated. Once it is concentrated, that is the indication that have more water. Right? Difference between disease and syndrome. Disease is like a normal dis-ease. It is actually called as dis-ease when the person is not comfortable. Right? Dis-ease. So it means, say for example, malaria, right? Malaria, it is a disease. When it comes to syndrome is combination of some signs and symptoms. So that means in case of malaria, when we say that there would be the fever, that fever would be with chilling, right? ठंड लगने के साथ, right? And then there is hepatosplenomegaly. That means the liver is enlarged, spleen is enlarged. So this is like a syndrome. Now, is it so that if the liver is enlarged and someone is having fever, so that means it is malaria? Not necessary. Not necessary. It could be, say, hepatocellular carcinoma. This is an extreme example, right? It is the worst cancer of liver, in which the liver would be enlarged, massively enlarged, and because the immune system goes down, as the immune system goes down, so there would be fever. But there is a difference between both of them, right? So hepatocellular carcinoma and the malaria, they are disease, but their symptoms, when you combine, so that is what is called as a syndrome, right? So that's why we'll be coming across several syndrome, and then we need to go for the differential diagnosis, right? So hepatosplenomegaly, that means liver is enlarged, spleen is also enlarged. Now, hepatocellular carcinoma, it will be affecting, cancer of liver will be affecting liver, right? If it has not spread, that means what is called as the metastasis. Metastasis means this particular cancer is getting spread to other areas, right? So that is where you have to differentiate between both of them. So that's where you go for CT or MRI and you see what is the structure. You do the ultrasound to see the structure of the entire liver. And when you write the report, that liver is homogeneously enlarged. Homogeneously, मतलब बिल्कुल एक जैसा enlarged है पूरा, right? So that means we are dealing with hepatomegaly, enlargement of liver, but it is even. But if there is some space occupying lesion whose texture is like this echo texture has changed, and with the dilatation of portal vein, because there is hepatic triad. Triad means तीन चीजें एक साथ. Hepatic artery, portal vein, and the bile duct. These are the three things which are together. That's why it is called as triad. So then you need to watch that what is enlarged. बड़ी simple सी चीज है. If this is the liver and things which are going inside, if there is a block, so obviously these tubes will be enlarged because of the back pressure, right? We'll discuss right now. Don't worry much about it. Don't send messages for that. Wait. मत भेजो इसके लिए मैसेज यार अभी. See, sometimes when I give you the example, it is just for understanding, right? Hepatocellular systems तो बड़ी डिटेल में एडजस्ट करें डिस्कस करेंगे, बट इतना समझो कि इफ देयर इज अ ब्लॉक ओवर हियर, तो ठीक है ना, बैक प्रेशर आया, देयर इज अ पानी की ट्यूब और यहाँ पे बंद किया तो दिस ट्यूब विल स्वेल अप बिकॉज ऑफ द बैक प्रेशर. बस दीस आर द बेसिक प्रिंसिपल्स. किसी को किडनी स्टोन है तो जहां पे किडनी स्टोन है उसके ऊपर का एरिया, राइट, दैट वुड बी एनलार्ज्ड. So so this is the kidney, right? This is the calicial. Over here, there is stone. So yes, the kidney would be enlarged because kidney is trying to push the water, and because of back pressure, it would be enlarged, and that is called as the hydronephrosis. Nephro means kidney, hydro means water. Because of the water, kidney is enlarged. So then you compare it with the opposite side, and then you come across this, right? So many of the diagnoses, they are like very logical, but this is how it really goes, right? So that is the difference between, say, disease and the syndrome. Good question. I'll just see the messages later now. Right? So for the low energy, think of weight. And regarding this weight loss and fat loss, it goes from person to person. Acha, I'll just put it over here. There were few myths regarding that. Do you take personal trainings? Yes, right. There are few my personal training of senior students. But yes, I was planning to start a personal training for even your batch, but it is a paid thing. Payment, the amount is not that high, right? It is a very small amount, but it comprises of your studies along with your fitness, right? And any of the personal problem, and in which there would be one-to-one once a week, right? I do talk to my students on one-to-one basis, so that कई बार क्या होता है कि as they go for the exam, कभी depression हुआ, life है कोई भी, for any problem, anything and anything, and एंड अगेन ये चीज मैं वापस भी बोल रहा हूँ, पहले भी आपको बोला था, यू कैन टॉक टू मी विद एब्सोल्यूट कॉन्फिडेंस. जरा भी टेंशन मत करो कि आपकी एक भी चीज कहीं बाहर जाएगी. यू मस्ट हैव नोटिस के कुछ चीजों के लिए मैं बोल देता हूं बट आई नेवर टेक नेम, सो डोंट इवन वरी अबाउट इट. यस, आई एम रियली प्राउड ऑफ यू गाइस फॉर एज यू हैव ओपनड योर हार्ट टू सच एन लेवल. एंड दूसरा 4-5 मेल के जिसमें आपने इतना अच्छा लिखा था पर आई वाज अनएबल टू आंसर इट, बट सो इन जनरल सबको थैंक यू, right? Because you took so much of time to write and you really opened your heart. हाँ, I think you were there, right? But मैं आपको reply नहीं कर सकता. Still, yes, many of the emails are left out. हाँ, regarding this, let me take this thing very quickly. Regarding the X-rated contents. See, last time जो बोला था, only 2 points. I'll say just 2 points. मतलब if you say that you are watching such content, will I be judging you? Not at all. मतलब देखो, लोग शराफत मारते हैं कि अरे ऐसा देखता है वैसा देखता है. एंड व्हेन दे आर अलोन, लोग शरीफ कब होते हैं? व्हेन दे आर इन फ्रंट ऑफ एवरीवन, राइट? रोड पे एक 5 रुपए का सिक्का रख दो, राइट? वो मर्सिडीज वाला भी उसके हाथ में आता है, यूं देख के लेके पॉकेट में, राइट? 500 का नोट रखो, नहीं सीरियसली यार, 500 का नोट रखो एंड जस्ट पुट अ डमी कैमरा. मतलब कैमरा दिखना चाहिए, राइट? हाँ, सब शरीफ हो गए. कितने शरीफ नहीं है वो, हम जमीन पे पड़े पैसे नहीं लेते. एंड अगर जो यहाँ पे इफ देयर इज अ टेबल, राइट, तो उठा के, अरे ये किसी का पैसा गिर गया था, व्हाट, मतलब शराफत दिखाने के लिए. आप कैसे हो आपको खुद पता है. सो इट इज लाइक इफ यू से दैट यस आई वॉच पॉइंट, आई एम नॉट जजिंग यू, इट इज ओके, राइट? बट ध्यान इतना रखो, वट एवर यू शुड नॉट बी एडिक्टेड, राइट? नाउ दिस इज वेरी आइडियल थिंग, यू शुड नॉट बी एडिक्टेड, बोलने को तो बोल दिया. The thing is, I'm not telling you to cut it down to absolute zero right from the day one, right? It would be difficult. If you're spending that much time, yeah, I can understand it is difficult. What you do is the best alternatives, right? One, what is called as the power exercise. Power exercise. Power exercise is what? Get a punch bag. इवन वहां पे भी जब आप हॉस्टल में रहोगे, अपने रूम पे एक पंचिंग बैग लगा लो. इट इज नॉट दैट कॉस्टली. मतलब इंडिया में तो क्या 2,000 रुपए में मिलती है यूनिवर्सल की अच्छी पंच बैग. एंड इट लास्ट. मतलब आप खींच खींच के मार के उसको तोड़ दो, राइट? बट इवन वो पंच बैग तोड़ने में भी 1 साल लग जाता है. एंड देन बी प्राउड ऑफ इट कि यार क्या पंच बैग तोड़ डाली, राइट? गेट अ न्यू वन. उसको थोड़ा कोई आराम से. But when you do this, this temptation is because of the spike of testosterone. Very few know that even testosterone levels, they go up and down, up and down. It is called as the circadian rhythm. It goes, and that's the reason. That suddenly when the testosterone levels spike, and if the person is not knowing how to handle, he'll go nuts. He'll go crazy, right? क्या काम उल्टे करते हैं? One, going towards porn. Second, smoking. Third, alcohol, right? And then starts all the पैंतरेबाजी कि let me impress her, इसको impress करो, वो impress, and right, and फिर पूरे दिन वो चलता रहा. Very harsh thing, but this is the brain. In brain, for males, it is written in big letters. This is hardwired. Brain is hardwired. Brain of male is hardwired for sex. For female, this is like emotions, right? They both are totally different. So that's why, in case if you are interested in reading this book, right? Men are from Mars and women are from Venus. Chalo, I'll put it into our shared folder, right? I'll put that book. Take your time, right? वो book story की तरह मत पढ़ना. Digest it. टेक इट एट अ वेरी स्लो पेस. रोज का 5 पेज पढ़ लिया, अरे 5 तो क्या, छोड़ो, 2 पेज, right? Just read 2 pages a day, चलेगा. But in every time there will be aha factor. Oh यार, मैं इतना पागल हूँ, इतना मूर्ख हूँ, इतना समझ नहीं आता. And you might go back into your timeline. कि हाँ, मैंने ऐसा बोला था, मैंने ऐसा किया था. And then there would be like lovely warnings for every female, right? Never let anyone. I do have one book on gaslighting, but it is a very acidic book. Very volatile content is there. I mean, पढ़ते पढ़ते आपका खून गर्म हो जाए. There, it is based on dark psychology. That is when you have to really handle such situations. So then, how to really handle, right? But अभी के लिए नहीं. But कभी भी, if you feel like, right, at an individual level, just let me know. If you really feel like, yes, you can tolerate the things to that rigorous level, and if you really need it, I'll personally talk to you before giving that book to you, right? I do have some very dangerous books. These are, I tell them they are dangerous books, right? अच्छा, दूसरा, dark chocolate, right? Dark chocolate, maybe more than 80%. More than 80% पे क्या होता है? When the cocoa is more than 80%, then it will be bit bitter. बस वही तो चाहिए, right? So you can try these two things, very effective, right? Very effective. So definitely do this thing. And third thing, वो थोड़ी philosophical चीज हो गई, give respect to females. This has to be inbuilt in my every male student. Even जब मैं पर्सनली भी बात करता हूँ, तो आई डेफिनेटली से दैट कि बॉस, अगर जो मुझे पता चला कि तूने किसी का इंसल्ट किया, तो देन इट इज लाइक फॉर लाइफ लॉन्ग, इट इज अ क्रॉस, राइट? एंड आई एम very blunt on it. So it's like I live on extremes, right? Those who are in my inner circles, they are my friend for whole life. But अगर जो मैंने ना बोल दिया, and if they are out, they are out. Then वो मर जाए तो भी I don't care, right? So ये ध्यान रखना. एंड कुछ गलत करो तो बता देना, राइट? माफ भी कर देते हैं, बट ऐसा गलत मत करना कि माफ करने लायक भी ना हो. सो आई थिंक आई सेड इनफ फॉर दैट, राइट? सो मेनी nice synthesized coffee. Okay. In gaslighting, because my gaslighting, okay, gaslighting is like emotional. I think we talked about it, ना? 1023 का पूछा हुआ है. So it is like emotional blackmail. We'll take one extra session on that. हेडेक मतलब आपकी नींद पूरी नहीं हो रही. एज प्री वर्कआउट सुधांशु, प्री वर्कआउट दोस्त, आपके लिए सबसे बेस्ट वुड बी द two things. One, taurine, right? Because of this weight, you need to do exercises which should really raise your heart rate. What's your resting heart rate? Because I won't be able to tell you precisely before knowing that. Send me your RHR, right? Resting heart rate. The resting heart rate, which you measure as soon as you wake up in the morning, and then you take the pulse just even before you get up from the bed. So that is your resting heart rate. Accordingly, we can plan out your pre-workouts. Okay. Very quickly. Black background is good. Watching current wiring difficult to watch. Enough is totally agree. But there was a reason behind it, right? I'll just show you. Dehydration affect bilirubins or salts. Definitely dehydration affects. Yes, I think you have sent me your emails also. Okay, Aditya. The thing is, say power exercise and dark chocolate will solve many of your problems, right? So should follow. Try it and then let me know, right? You can even send a mail. So I'll tell you the details of that personal training. I'll tell you the details. See, as you exercise, as your fitness level improves, resting heart rate will start coming down, right? It will come down. Normally it is called as about 68 to 70, right? Normally 72. as you exercise, it can come down to 65. And when it goes below 50, I'm sorry, below 60, so then you'll be able to sustain for very long duration in long runs. So it has to be like that.
Sir, some of the athletes, marathon runners have 45, right?
Are 45, I was about to say that. Bjorn Borg, right? Bjorn Borg, tennis player, his heart rate, resting heart rate, 38. Federer, resting heart rate, 40.
Sir, but
Roger Federer.
it's not good, right?
It's absolutely good. It's awesome. That means that the left ventricle is pumping the blood so powerfully that in it is only 40 times it has to beat in 60 seconds. So every beat is coming at 1.5 seconds. So that, right? So that means it is pumping the heart with so much, pumping the blood with so much of power that heart condition is awesome. As the heart rate increases, heart is not beating like this, heart is beating like this. And when it goes beyond 200, 250, so then it is called as the fibrillation and flutter, which are cardiac anomaly. Flutter is matlab when pakshi jo hai, unka bird, unki jo wings hai, that is, it is like flutter. So heart muscles, they are doing like this. Very less amount of blood is pushed, right? So that is not good. Lower the heart rate, better it is, because it is the indication of how powerfully the heart can really beat. And as you do more exercise, proper exercise, right? More is no, there is no point in staying in the gym for 2 hours. No, proper exercise. So that proper exercises will improve your cardiovascular efficiency. Not only the heart, but the blood vessels, also your respiratory system, right? Your lungs become more powerful. Ah, yes. Chocolate is tasty. It is. It is. And regarding the personal training, yes, it all these are included. I design even the diet and this everything, everything. It's like then you are my kid. Okay, so I think we need to start our today's topic. So for the X-rays, this was an accidental discovery, right? And William Conrad, right? William Conrad Wilhelm, he was the person who was experimenting, and then suddenly he saw these plates. So he found that those photographic plates, they were illuminating in the dark. So he was very surprised that what is illuminating these plates. Then he figured out that yes, there are some rays which are coming out, but what name to be given? पता नहीं क्या नाम क्यों था. He was not very clear. So he said कि इसका नाम रखो X-rays, right? बस. So since then it is called as the X-rays. 8th November. 8th November. It is called as the Radiology Day, because that was the day when those X-rays they were invented. So in the memory
Just
of
like X chromosome.
X chromosome, exactly. Right. And so William Conrad Wilhelm, so he declared, and then the first X-ray which was taken. Next time I'll show you all these X-rays because there is another PDF of that. But today I just wanted to discuss the basics. So that's why I'm just showing you this part. So he took the X-ray of Martha. Martha was the name of his wife. So that finger, that ring, it became internationally famous because that was the first X-ray. He must have said, "Rakhna haath, like, let me take this X-ray. Dekhte to hain kaisa aata hai." And that became the first X-ray. Now, there is what is called as the electromagnetic spectrum. Electromagnetic spectrum. Now, this electromagnetic spectrum, this is where it travels at the speed of light, right? That is 3 lakh kilometers, 3 lakh kilometers per second. or 1,88,000 miles per second. This is something which is used for all those, say, our distances which are to be measured in space, right? So all those astronomical distances, they are measured. Say, for example, say when you see the sunrise, right? So that sunrise is 8 minutes and 22.5 seconds. It has already, the sun has come onto the horizon. So this is our Earth, right? And this is our line of sight, and sun has reached over here, and we say that this is sunlight. No, but actually the sunlight occurred 8 minutes and 22.5 seconds earlier. But then the light started traveling 3 lakh, 3 lakh, 3 lakh, 3 lakh. With that calculation, 3 lakh, 3 lakh, 3 lakh, 3 lakh, 3 lakh, 3 lakh, and it reaches to you. And it reaches to you. And you find that, Suraj uga. No, but it took this much distance because the distance is so high. Distance is so high, so that's why it is taking so much of time, right? So over here in electromagnetic spectrum, there are two things. One, the frequency, and second is what is called as the amplitude. Again, we have to be we are interrupted for a second. Be right back. There is some renovation going on, so even if I tell them to come at 12, they come early. So it takes about this much time. So in this magnetic spectrum, when we make a wave, right? When we make a wave, so then distance from here to here, it is called as the lambda. That is the wavelength. Length of one wave is wavelength. This is what is called as the amplitude, correct? Amplitude. And this is called as the crest, the highest area, and this lowest area, it is called as the trough, right? So it is the combination of one crest and one trough that makes one wave, and number of waves per second. That means in how many waves they are happening in 1 second. That is what is called as the frequency, correct? Frequency. So frequency is number of waves per second. From radiological aspect, what we need to remember is that there are two types of waves. Right? There will be two types of waves. For X-ray, it is a very specific segment. Right now, we are not going for that, but just understand frequency. There is one, it is going like this, and second is going like this. Which, this is A, this is B. Who will go for a longer distance?
So B.
B,
Uh,
B.
what?
A
B.
will be going
B.
for longer distance.
Reason?
B.
If you drive it like a 1 liter petrol, you put in the bike and then you go it like this, or you go like this, obviously, right? You'll be traveling to a longer distance this way. That means lower the frequency, higher the distance, correct? Same way, when you can adjust the X-ray. So on the X-ray machine, there are various dials, right? What is called as the kV, MA, right? Kilovolt, milliampere. So it is like if whether you are driving a car, which is like with very small engine, or you are driving an SUV, and then you are hitting something. So with what power you'll be able to hit? How much deep can you really go? If the power is more, obviously you'll be able to penetrate much faster, much deeper, right? So over here, it will be exhausting the energy very early. So that's why it won't be able to penetrate deep into the tissues. So it will be dying on the surface. That means this entire energy will be transferred to the skin, to the tissues, to the cells. Now, this is a radiation. What radiation does is very simple सी चीज. This is cell. That radiation, as it touches, that as it enters the cell, it will break the water content, and the cell would be having no water or less water, and this cell would die. This is what really happens into all those nuclear blasts. They work on this principle. So that's why when they blast, there is one what is called as the blasting effect, the black zone. Black zone in which everything is destroyed, broken, perished because of the impact. But then the radiation wave starts. So buildings and everything remains as it is, but in those areas, not even a bacteria would survive. Reason? Absolute dehydration of the cell. Right? So said that cell is broken. While this low frequency can penetrate deep into the tissues. So just remember this, because if you're taking X-ray of abdomen, so then you have to change the setting. If you're taking X-ray of thorax, so then you have to change the setting. If you're taking X-ray of some bacha, so then settings would be different. If you are taking X-ray of someone who is say 200 kilogram or sumo, so then you have to change the settings completely. Right? So this is the basic, first basic. The second basic, here is one board, right? And we put a torch over here. We put a torch. One object A here, second object, same size here. What would be the size of image projection, right? The image, because when the torch would be switched on, so there would be the image of A and image of B. Whose size, image size would be bigger?
A.
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 A would be
A.
correct. Second
B will
question.
be in the shadows of A.
That's right. That's right. We will be in shadow of it. Maybe we can put it like at a distance so that they are not overlapped. But very, very true. It will be like that. Now, next question. Whose image would be sharper?
B.
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 Now you are a radiologist.
Sir,
Seriously.
it's because of dispersion, right?
That's right. That's right. So our principle, right, as we'll watch any of the X-ray, our principle would be very simple. We want the image which is formed on the screen, it should be sharp and it should be less magnified. Some magnification will definitely occur. It should be less magnified. Because even when we put the X-ray X-ray plate over here, the distance, say whatever the rays which are coming, they lead to some magnification, because it is not like we are just putting the X-ray film into the body. Correct. So there would be some magnification. So this is the basic principle. These are the two principles. Once you have understood, you'll find rest of the things very easy to understand. So here it is. Why do we go for the PA, postero-anterior? देखो बड़ी simple चीज. Where is heart? Anterior. पीछे तो lungs हैं, right? So we don't want our heart to be seen as enlarged. So if this is the body, heart is here. So that's why it makes a perfect sense to put the plate over here so that X-rays, they are coming from the back. So that means the plate is here, X-rays, they are coming from back. So that's why it will be called as the PA view. Postero anterior. That means this is the direction. This is the direction of X-rays, right? It is the direction of X-rays. And why do we want that? Because when the X-ray plate is in front, so we don't want the heart to be magnified, so that heart will be seen as a normal size. So it means that if I take AP view, then in AP view, definitely heart will be looking much bigger. Let's see that, right? Dekho. Here, this is PA view. This is the size of the heart. Same patient, AP view, look at the size of the heart. है ना? Very simple सी चीज, because now the heart is here. So when in AP view, so this is anterior, this is posterior, यहाँ पे plate है, so this heart is going to be projected bigger, right? So this is why in all normal cases, we will be going for PA view. This is the most common view. AP view heart is magnified and left and left. That's right. That's right. 573. Okay. सैटरडे क्या डिस्कस किया था? Saturday we discussed some new things, lithopodium वगैरह. मतलब it was just a fun lecture. मजे से बातें की थी. So academically you have not lost anything.
Okay, so thank you. So that link was not opening. Google link was not opening.
Huh?
Google link was not open.
What was not open?
Google link, that PDF and all link was not open.
Uh-huh. Acha. So this is the most common view because in this view your patient has to stand. Right? So that's why this is the most common view. If the patient is unable to even stand, so you don't have any choice but to, this patient is lying, right? And then you just slide the X-ray plate underneath him, and then with the portable X-ray, right? You just put the tube like this, and then you take the X-ray. So in this case, this is the nose. So this will be the AP view. Right? So direction of X-ray from posterior to anterior, very much logical. This is the important point. Now, this is where we start using our surface anatomy. Inferior angle of scapula, so easy to figure out, right? So easy to figure out. So inferior angle of scapula, like line, draw a line and then put a marker. Because when you switch on the light in X-ray tube, right, there is one light switch and X-ray beam that we just can't see, right? So like a sniper target, right, there is a crosshair. So that crosshair, you just place it between two inferior angle of scapula. X-ray beam is centered, it is called as the centering at inferior angle of scapula. Now, this is just for the information purpose. That's T7. So this is the body of T8, right? Body of T8, and T7 will be above, and its spinous process will be like this. So here, what have you noticed? Two things. T7 spinous process or T8 body. This is where the link, that light X-ray will be passing. Got it? Right? So it is the T8 body or T7 spinous process. And this is visually, if you want to take it, this is like inferior angle of scapula, right? That's the level.
Sir,
Google को हाँ
sir, can you explain? My connection was down.
कोई बात नहीं. See. So this is what is called as the crosshair. Okay? This is called as crosshair. So before taking the X-ray, you switch on the light, so there will be light projected from the X-ray tube. So it will tell that where the X-rays will be going. So if this is the person, right? This is the person. These are the inferior angle of scapula. You just take the lower angle of inferior angle of scapula and take a center of it. This is where you'll put the cross mark and then switch off the light, push the button, and the X-rays will emit and the X-ray is taken. So this is called as centering. This centering will keep on changing depending upon which X-ray are you taking, right? But this is the easiest centering for the X-ray chest PA view. X-ray chest PA view. You got it? Now, this
Yes,
is
sir.
kilovolt potential. This is kilovolt potential, low or high. It is the same logic what we discussed. It can be low kilowatt potential, right? So here the takat of X-ray is less, right? Kilovolt potential is how much takatwar the X-rays are. So if they are less takatwar, so there will be low penetration, right? There will be low penetration. So they won't be able to go through and through. So if they can, so there would be high contrast. Now this is very, very easy to understand, but unnecessarily in books sometimes it is made complicated. X-ray is the game of shadows, right? Now I'm giving you a visual picture. Let's say this is the X-ray gun. 100 X-rays they have started from here. And there is one object over here. 50 X-ray यहाँ पे टकरा है. This object tells कि I am a metal. I won't let even one X-ray go through me. So fine, नहीं गए. बाकी के 50 ऊपर नीचे से निकल गए. The image which would be produced on the screen, the entire thing would be, right? Entire thing would be totally black. And this in between, because not even one X-ray was able to pass through it. So it will be looking white. Right? Second scenario would be the object which is over there, it is very soft, right? So 50 X-rays which were striking on this, out of 50, it allowed 40 X-rays to pass through it. So now again, you will be able to see this would be absolutely dark because it was like all rest of the X-rays. But ये भी जो है थोड़ा grayish pattern हो गई ना. It would be a bit of grayish pattern. Because at least 40 X-rays so they were able to hit. Contrast is nothing, but it is how much, what's the difference between lowest and the highest shade. The difference between lowest and highest shade. So over here, if I say this thing as 100 and this thing as 0, so there is immense contrast, right? While in this case, if this is 40 and this is 50, so there is less contrast, correct? So here, when there is high penetration, तो मार के भी X-rays चलो reach to the X-ray plate. So when they reach to the X-ray plate, when more X-rays they are reaching to the X-ray plate, there would be low contrast because there'll be relatively less difference between most bright and the most dark area because there'll be a number of gray patterns because sub X-rays पहुंचे. But over here, when there is low penetration, तो ये तो बीच वाले तो वहीं पे मर गए. जरा सा टिश्यू आया मर गए. Jarasa tissue, those X-rays died out. So those which reached, so they will be giving high contrast. This is a golden principle of radiology. So when to adjust what kV, right? This is so typical. Then exactly like photography, रात को photography करनी है. Let's say you want to do the photography of fireworks. So you won't be able to conduct just one click and done. No. You have to put it on B mode. You have to take a remote in hand, put it on stand, and then press. B mode is it will just open the aperture, and it will remain open till you close it. So you just count 1, 2, 3, stop, and then it starts. So that large amount of light entered and it illuminated the CCD, charge coupled device. So same way over here. Timing is also important, that what timing is to be done. So accordingly then there is milliampere. So calculation of all of that thing will come to that how much radiation is actually entering into the body and forming the perfect image. Right? There is a very, very fine formula, etc. for this. But you understood that this is how images are formed. Now this is our normal X-ray chest, right? Normal X-ray chest. The order in which you'll be watching this X-ray chest, it has to be same order. When I'll be teaching you medicine, I'll be telling right from the day one that irrespective of whatever the disease which you're talking about, you'll always for the rest of your life will be following the pattern of congenital, traumatic, inflammatory, neoplastic, miscellaneous. If you follow that pattern every time, you keep on following that pattern, then your brain will start analyzing it that way. Same way, whenever you see the X-rays, you just follow this simple pattern and you'll be surprised that within seconds you'll start diagnosing so many things. This is the first thing. As soon as the X-ray is given to you, because if you know the pattern, so then your brain will कहगा हाँ ये ठीक है. Now this is okay. This is third. Otherwise, you'll just watch कि मैं क्या देखूं. Right? No, diagnoses are never made like that. Even if it is a spot diagnosis, I'll show you some of the X-rays which are like spot diagnosis. The moment X-ray is shown, within 5 seconds, you have to give the diagnosis. You can do that, right? This is answer to I think I remember the name, Rampa. I think you asked, you sent those 3 emails that you are unable to understand in the radiology. This is the answer of that. Follow the pattern. First pattern. Watch this. Can you watch this? Let me zoom it. there is a dark shadow, right? There is a dark shadow over here. Now, जैसा हम हिस्टोलॉजी में करते थे, आप लोग ऐसा रेडियोलॉजी में मत करना, राइट? हिस्टोलॉजी में तो नहीं करेंगे, बिकॉज इट्स लाइक, say, teacher used to, there was microscope, right? And the teacher used to show the slide, and उस slide में marker रखा होता था, and then it is said कि देखो, this is columnar epithelium, right? अब पढ़ के तो जाते नहीं थे कभी, तो देखा, टीचर उससे दिखा, हाँ, क्या, हाँ, कुछ पता नहीं था, because someone moved the marker, someone moved the marker, and then when teacher would say कि क्या दिखा, then that was a trouble, and then they say कि बोला क्यों नहीं, अब टीचर को कैसे बोल रहे यार, in front of so many beautiful girls, how can you say कि नहीं पता चला, तो then what would they think कि यार ऐसा idiot है, right? So वो हाँ हाँ करते रहते थे, कभी समझ तो आया नहीं, फिर हॉस्टल पे जाके यार क्या था, right? So that's how हालत थी, but now it won't happen, because you'll be able to see everything on big screen, on your screens, with the marker and everything. So histology में भी ऐसा था, एक्सरे में तो कभी ऐसा मत करना, right? If नहीं पता चले तो पूछ लेना. So this is what, this first thing, क्या है ये, कुछ black color है, dark color है, right? It is dark color. तो this is the, हाँ बोलो.
Sir, is it artery?
अच्छा, ठीक है, wait, दोस्तों,
Bronchi.
आर्टरी हो,
वॉइस वो
Is it bronchi?
क्या ट्यूब रहेगा?
हाँ बोलो.
ट्रेकिया
ट्रेकिया कौन बोला, ट्रेकिया कौन बोला, फर्स्ट किसने बोला? आई थिंक श्रवणी. शाबाश.
यस सर,
दिस इज ट्रेकिया. हाँ ठीक है, दक्ष, गुड, राइट, दिस इज ट्रेकिया, दैट्स राइट. This is trachea. And Urula, now for rest of the life you will never forget this. पता है ये जब गुप्त पिक्चर देखने गए थे ना, तब हुआ था, मतलब बड़े कॉन्फिडेंटली कि नहीं खून तो इसने किया, बाद में पता चला यार काजोल ने खून किया. आज तक याद है कि यार वो आई वाज दैट स्टूपिड, इतना पता नहीं चला, राइट? बिकॉज इमोशंस आर इन्वॉल्व ना, इंसल्ट हो गई. So this is trachea. Why trachea is important? Because trachea is in center, right? This is called as, I'm introducing a new word. It is called as the mediastinum. Mediastinum, this is like the entire chest. Entire chest is divided into right side and left side. दो भाग में divided है. And in between there is space, right? So यहाँ पे एक lung, यहाँ पे दूसरा lung, and in between that space, right, there is heart which is sitting. Right? Actually, it is like compartment.
So basically, the space where heart is located is mediastinum.
Exactly. The heart is into the middle mediastinum. Exactly.
Sir, then what is cardiac notch?
Cardiac notch. See, this is the lung, right? And this edge, right? You remove the heart and then watch. So you'll find that yaar heart, ये lungs में कैसा खड्डा हुआ है. That is the cardiac notch, right? The entire cardiac impression. And there are so many things into that cardiac impression. Right? We'll come to that just in a while. So both the things, they are like your left lung and right lung, they are there, and in between there is trachea. Because what would happen to trachea? Trachea will go down, right? Trachea will go down. Let me see ऊपर draw करते हैं. Trachea will go down and it will divide. Right? Then it will divide. So that's the trachea. So trachea has to be in center. It can be pushed on one side or it can be pulled on one side. That is called as when the trachea is deviated. I'll show you later. Right now, we are watching normal X-ray. Later, we'll be watching abnormal X-ray. So, in which the trachea would be shifted, right? So, you'll find that this is so wonderful, absolutely beach mein hai. When it is shifted, yes, you'll be able to see it. It is literally like this. So, when the trachea is on one side, right? This is the right side, this is the left side. Two things can occur, na? Either someone is pulling, यहाँ से खींच रहा है, right side से someone is pulling the trachea on one side, or someone is pushing. ठीक? Agreed? You got this point? Right? Either it is pushed or it is pulled. So whenever there is SOL, space occupying lesion, यहाँ पे there is a lesion. कहाँ पे? Suppose यहाँ पे देखते हैं कि upper lobe of left lung, it is having lesion, cancer. Right? Carcinoma. Consider carcinoma. There could be so many things, but right now just take it like carcinoma. So that is expanding. So it will push the trachea on the opposite side. So trachea is deviated, and we say this as a mediastinal shift. So that it is said the X-rays that would be written straight away. It will start as that there is a right-sided mediastinal shift. So how was it said? Because of the trachea. Correct. First thing. Or opposite side में lungs है. There is right lung. What if that lung shrinks, and that is called as the fibrosis? Fibrosis. So in fibrosis, what tissue they are just constricting. So it will pull the trachea because everything is interconnected, right? There are tissues which are connecting. So it will
Connective
pull the
tissues,
trachea.
right?
Exactly. So it will pull the trachea. So here, this would be a pull, and this one would be a push. So the moment the trachea is shifted, now you are knowing it that मुझे ये दो में से एक चीज देखनी है. And immediately, if it is a space occupying lesion, तो its density would be different. Clearly दिखेगा. And if it is, हाँ ये बताओ, if it is fibrosis, तो fibrosis में what would be the appearance? It would be black or white. Black or white. इतना बोलो पहले चलो.
White,
Black,
because fluid will be
white,
filled, right? White.
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 White क्यों?
कनेक्टिव टिश्यूज वो उनके अंदर चले जाएंगे.
Connective tissues. और दोस्त सुन, connective tissues तो बराबर. There is no air ना. Connective tissues तो सब solid हो गए. Air को तो भगा दिया.
हाँ
Because the
वही
lung
एयर.
has destroyed itself. So that's why this would be looking white. So देखने पे पता चल जाए कि either अगर जो trachea is shifted on one side, so where is that white tissue? Because if there is mass over here, तो वो भी white दिखेगा. And if this is fibrosis, so that will also be seen as a white area. But one important thing, so immediately देखते it seems like right-sided upper lobe fibrosis. People say कि यार पता कैसे चला? Because it has been pulled on one side. जहाँ पे pull हुआ, opposite side में there is no mass seen. जिस side पे whitish है, accordingly the diagnosis goes. The second point, you watch the margin. Whenever there is space occupying lesion, the margins are sharp because it is a consolidated lobe, consolidated structure. When it is fibrosis penetrate into the tissues randomly. So that's why margins would be irregular, right? You'll be able to see this thing very clearly on CT scan or MRI. And in MRI, so you have got one more cutting edge T1 and T2 weighted, right? So that you know that what are the inner contents of it, whether it is just a fluid filled sac, right? Fluid filled ball, or it is some infection. So all those things you'll be able to see it very properly. If you want to go for still further investigation, you can go for PAT scan or SPAT scan, right? That will take once we discuss the this cross-sectional anatomy when we'll start with, right? So then we'll take it. But you got the importance of it, that this first observation, it is telling you so much, right? Thus, there are only 6 points. You watch those 6 points and you'll be able to say so much about that person, right? Puri Janm Kundli. Now comes the second part. I need to remove this. Let it remain. Can you see? I'll just remove this arrow. Can you see this goal as a chara? right? Watch this now. Wait, another X-ray. Here it is. Here it is. See, can you see this curve?
Yes.
So this
Yes,
this
sir.
curve is like this, and then the heart goes like this. So can you say that it is going like this? A smooth curve. If this becomes like this, spot diagnosis. Spot diagnosis is mitral stenosis. Guessing. So first we identify the normal structure. This curve, it is called as the aortic knuckle. It is called as aortic knuckle. Knuckle. Right? When you do this, so this is called as, these are called as the knuckles. So this is where there is some prominence. Right? There is some prominence. That is what you are watching. Right? What is the importance? We'll see that. This without saying, you will be able to say, so that's why I have not marked that this is the left heart border and this is the right heart border. So no big rocket science. So I am not marking it. Right? So this is the aortic knuckle, you should know. The third thing which you have to know is, can you watch the ribs, right? You are watching the ribs. Oh, sorry. Those, we have to stop for today. Day after tomorrow, we'll definitely complete this thing, right? Today I have to, I just never realized it's 11:30. So sorry, right? We stop at this point, but day after tomorrow, we'll surely be completing it. Okay?
Sir,
Okay.
I would like to ask you,
Huh?
the ribs are of gray or black color in this image or X-ray.
Huh? Huh? Just a minute. Huh? Ribs are of gray color because there is
So,
superimposed shadow.
Black is
Superimposed.
lung.
Black is lung. Exactly. Black is
So,
lung.
sir, in this X-ray, in the heart region, it's perfectly white. So the
Hmm.
heart is not. So the X-ray is not passing through the heart.
Exactly. Because heart is big, na? So there is so much of tissue, so much of blood, right? So that's why it is not allowing so many X-rays to pass through it. So that's why it is white. Pretty
Why are
white.
ribs gray and the lungs are
Because
black?
ribs are very thin. These ribs are very thin. They are like flat bones. They are thin ribs.
Okay,
That's
sir.
also at the sternal side there is cartilage, right?
Sternal side, there is cartilage. That's right. So that's what we'll be looking at next time, that how to identify that, right? It would be very interesting. As such, I'll be putting this into our shell folder with that book, and we meet day after tomorrow, right?
Yes, sir.
Thank you.
Yes,
Yes,
Thank
sir. Thank you.
Bye,
Thank you,
sir.
sir.
Thank you,
Thank you, sir. Bye, sir.
Thank you, sir.
Thank you, sir.
Bye, sir.
Thank you. Thank you.
Thank you, sir.
Bye, sir.
Bye bye.